Welcome back to Mountain State Pharmacists. May 22nd is Infectious Disease Pharmacists Day to recognize infectious disease pharmacists and their impact on patient care and the contributions to the healthcare team. I have the pleasure of interviewing a friend and classmate, Dr. Jen Sparks, PharmD, with the Marshall School of Pharmacy, to share a little about her career path of infectious disease pharmacy and why Infectious Disease Pharmacists Day is such an important day to recognize right here in West Virginia and beyond. Thank you for joining us on the podcast, Jen.
Thank you for having me.
To start off, why don't you tell us what does an infectious disease pharmacist do and how does that differ from maybe other career paths of pharmacy?
ID pharmacists have specialized training in infectious diseases and antibiotics that is a little bit more than what your general pharmacist might have. They focus on the appropriate use of antimicrobial agents that would include antibiotics, antifungals, antivirals. What we do is we make sure that when patients are prescribed one of these medications, that it is correct for their infection. We also help select the appropriate drugs that will treat the infection safely and effectively. One of the ways we do that is we use the electronic health record or the computerized patient chart. And what we do is get reports based on either positive culture results, which we know as bugs, or selected antimicrobial agents or the drugs. We then review the patient's therapy plans and identify whether they are an optimal drug therapy to cover their bugs. Some of the interventions that you might do as an ID pharmacist would be identifying safety or efficacy concerns related to the antimicrobial dosing and working to optimize their dose. De-escalation or antimicrobial streamlining, it's often called, which means changing from broader coverage antimicrobials to more targeted options. This can also be escalating to a more appropriate antimicrobial coverage once the culture information is available. Some of the places that you might see an ID pharmacist typically would be in a multidisciplinary team in a hospital. And what they do is work closely with physicians, PAs, nurse practitioners, microbiology, and some other healthcare professionals. We also train our residents and students and other preceptors. And what's cool about that is that this setting encourages this collaborative environment where we learn from one another. And the ID pharmacist in that setting is, of course, your drug expert. Some other places that you might see ID pharmacists, since this role is progressing, is like an outpatient antimicrobial therapy or OPAT. You see them in research, academia. There's a need for them in nursing homes, pediatric specialists. There's all kinds of roles that you can have as an ID pharmacist.
And how did you become interested in becoming an ID pharmacist?
I have always enjoyed biology, but my interest in ID started with my first microbiology class in undergrad. I ended up getting a bachelor's in microbiology from Marshall University. The course that really changed how I saw it was called Emerging Infectious Diseases, and it kind of brought it all together, the bugs and the drugs. It brought pharmacy and biology together. And that's why I wanted to be an ID pharmacist. And so after pharmacy school, I was fortunate to be presented with the opportunity to start an antimicrobial stewardship program at my hospital. And this led me with the opportunity to complete a certificate in antimicrobial stewardship through the Society of Infectious Disease Pharmacists, or SIDP. And then I was able to join a hospital collaborative. It was a statewide collaborative to improve antimicrobial stewardship in the state of West Virginia. And then went on to complete my board certification in pharmacotherapy and eventually infectious disease. And now I get the opportunity to teach infectious disease to pharmacy students at the School of Pharmacy. And what we go over is just common infectious diseases. I teach them how to identify or diagnose loosely and the most appropriate treatment for these diseases.
You've used the term antimicrobial stewardship a couple times. In very basic terms, what is antimicrobial stewardship and why is that the focus of ID pharmacy?
Antimicrobial stewardship is the antibiotics are used appropriately. That is the key to it. But this can include starting the correct antibiotic, for the most likely bacteria causing that infection while minimizing adverse effects or patient harm. Additionally, this includes stopping antibiotics when they are of an unlikely benefit to the patient, such as a viral infection. We saw a lot of this during COVID. This is the focus of ID pharmacists because antibiotics are frequently prescribed inappropriately, which can result in patient harm and contribute to the development of antibiotic resistance. So when antibiotic resistance happens, we are left with limited treatment options where there aren't any antibiotics left to kill bacteria. So this is a big role for pharmacists, but it's also critical that we educate caregivers and patients about the importance of using antibiotics appropriately. So since there isn't an endless supply of new antimicrobials in the drug pipeline, it's important that we use existing antibiotics wisely to preserve them for the future.
In the introduction, we mentioned that May 22nd is Infectious Disease Pharmacists Day. So tell me a little bit about that and about the 2023 theme, Reaching Beyond.
So part of the role of an ID pharmacist is to help provide reliable evidence-based education to both patients and other healthcare providers. Without effective antibiotics, many routine treatments will become increasingly dangerous, such as setting broken bones, basic operations, even chemotherapy and animal health all rely on access to antibiotics that work. It's important to remember that we need to slow the resistance to cut down on unnecessary use of antibiotics. So what we're doing is reaching out beyond just the healthcare profession. We're inviting the public, students and educators, farmers, veterinary, dental, and medical communities, and professional organizations to become antibiotic guardians. And also in third world countries, you can buy antibiotics over the counter. And this is also increasing our use of inappropriate antibiotics. So this is another way that we can reach out to the public and explain why this is not a good practice.
Is antibiotic resistance an issue in our state and surrounding states?
Actually, yes, it's a big deal here. For the past 3 years, West Virginia has led the nation as the top antibiotic prescribing state per capita. It's sometimes good to be number one, but this isn't one of those times. So using antimicrobials or antibiotics in this case appropriately improves patient outcomes, reduces microbial resistance, and decreases the spread of infection caused by multi-drug resistant organisms, which are starting to become commonplace in our local area. The last statistics I looked at, we had dropped to number 2 with 1,022 antibiotic prescriptions per 1,000 patients. Kentucky's number 5 with 938 antibiotic prescriptions per 1,000 patients, and Ohio's number 14 with 718 antibiotic prescriptions per 1,000 patients. So when you look at the West Virginia statistics, that's more than one antibiotic prescription per patient, which is a lot for a year's time. So are these antibiotics doing more harm than good? Well, they can be if they're not used appropriately. So appropriate use improves patient outcomes, reduces antimicrobial resistance, and decreases the spread of infections caused by these multi-drug resistant organisms. So we're starting to see more multi-drug resistant organisms in our local area. So if you're not using antibiotics right, it can be the exact opposite of improving these patient outcomes.
So how are we combating this locally?
Well, one of the ways is West Virginia has started an antimicrobial awareness clinical research and outreach team. It was created to promote appropriate use through antimicrobial stewardship targeted at both inpatient and outpatient clinical encounters. It is estimated that 80 to 90% of antibiotic use occurs in the outpatient setting. So I think that's where they're starting. And at least 30% of those prescribed were deemed unnecessary in a recent paper that the West Virginia Antimicrobial Awareness Program has published. So the goal of this collaborative is clinical research and outreach. So they're partnering with West Virginia medical providers who are faced with unique circumstances when it comes to navigating rural health and who do so much for our communities already, and they often have limited support. They're also providing useful tools that for both medical providers and patients. They're working together with West Virginia families so that they can improve antimicrobial stewardship and hopefully decrease prescription rates across the state. Kentucky has a Kentucky Antibiotic Awareness Group that has been in place for a few years now, and that has helped them so far to drop down to number 6. They were higher in the rankings for our states. So seeing their successes, we're using their successes to help improve the rates in West Virginia right now. And hopefully in the near future, we would like to expand these useful tools that we're creating now, one of which is a dashboard and a website that's for prescribers and patients and their families alike. So those are things that we're looking at right now.
So you mentioned earlier that this is a collaborative effort between many healthcare providers and even patients. So what are some ways that patients can assist a pharmacist or a physician to ensure that they're receiving the right treatment?
It's really important for patients to be actively involved in their care. And some questions that they can ask a healthcare provider: are antibiotics necessary for this condition? There have been studies done that if a healthcare provider thinks that a patient wants antibiotics, regardless of whether they actually need them or not, they're more likely to prescribe those antibiotics. But if patients are asking questions, it can open up a dialogue between them and their provider about prescribing antibiotics appropriately. So there have been studies done that if a healthcare provider thinks that the patient wants antibiotics, regardless of whether they actually need them or want them, then they are more likely to prescribe these antibiotics. But if patients are asking questions, it could open up the dialogue between them and their provider about whether antibiotics are actually appropriate or not. Some infections can be caused by both viruses and bacteria, like upper respiratory tract infections is a huge one. It's typically a virus, most likely, but sometimes antibiotics are prescribed just in case. That's the type of action that we would like to prevent. So another question they might ask are, what are some other things besides antibiotics that I might do to help me feel better? I think this is a great way for the patient to participate in their own healthcare. And some typical responses to this question include non-pharmacological treatments, rest, fluids, and over-the-counter medication for pain or fever, such as Tylenol or ibuprofen. These can help treat these symptoms. What can I do to prevent this from occurring in the future? This also engages our patients with their providers into good hygiene practices. And if there are vaccinations, immunizations available, then this would be a way for them to discuss those as well.
What are some ways that community pharmacists in a community setting could help?
Some ways that a pharmacist can be more antibiotic aware is to verify penicillin allergies, avoid duplicate anaerobic coverage, reassess antibiotic therapy. They can also check dosages. Some of the antibiotics are weight-based. Make sure that it's dosed appropriately. Make sure that the duration matches the indication. Right now, it's not mandatory for people to include the indication, but if the pharmacist knows the indication, they can assist our providers with making sure that it's dosed appropriately and be able to see, hey, is this the right duration for this? Another thing they can offer is to register your pharmacy for to dispose medications safely, because sometimes patients will keep antibiotics and use them again and again, even though they haven't been looked at to be diagnosed properly.
So, as you know, I am practicing in the community setting, and I often see antibiotic prescriptions with refills. That's got to drive you nuts. From an antimicrobial stewardship situation, why would a doctor do that? And is there any tips that you might have on how to maybe have that conversation with a doctor?
I guess there would be some circumstances where you would require refills in a chronic disease state, or if a patient has insurance issues where they only allow so many days of the prescribed medication. If you have a concern, then it would be best to identify the indication And what these extenuating circumstances would be that they would require a refill for these antibiotics. What would benefit us the most is more information. And I know in a community setting, your time is very valuable. So if more information was provided on the prescription itself, then it would alleviate some of these issues that are concerning our community pharmacists with this type of problem. But if you did have to call them, ask them why there's refills and make sure that it is appropriate.
So maybe even starting the conversation with physicians or prescribers that you deal with on a regular basis and asking them, hey, if it's not too much, can you just make that part of your protocol to include diagnosis when you write a prescription? That way I can check the dosage, while I'm in the pharmacy, I'm able to look at their drug allergies that I have, which sometimes differ from the records that you have, and just making sure that everything is in place. If you could make that part of your practice, that might go a long ways. Wouldn't you agree?
Yes, I would agree, because in a hospital setting, we have all of that information at our fingertips with the EHR. And that would be another way, is that if all of that was available to a community pharmacist, so that all the computers talked and you had the appropriate information.
But it starts with having that good relationship with the prescriber to be able to have that conversation and ask those questions.
Right. Yes, developing good communication between you and the providers, so that you were still doing the multidisciplinary team approach, even in the community setting that we have in a hospital setting.
You had mentioned drug allergies and making sure that we're getting them in whatever setting that we're working with patients. Is there any value or going beyond just the allergy itself and finding out the severity of the allergy? Does that help an infectious disease doctor or an infectious disease pharmacist to better prescribe?
Absolutely. If it's beneficial to know if it's an anaphylactic reaction versus just some hives, or what a patient may feel is an allergy may not be a true allergy. Like GIAP said, is not identified as a true IgE mediated allergy. But if it is anaphylaxis, then it would limit the use of that drug class, possibly even more. It could cause more resistance. Like me, for instance, I have an allergy to an antibiotic, and it limits what I can use. So it costs more for healthcare, and it increases the risk of resistance because it limits that whole drug class for that patient.
Well, and I can tell you that so often when we talk to our patients and ask them the severity of the allergy and what they experienced when they took it, so often they say that they don't even remember because it goes back to childhood and they had a bad experience with an antibiotic and they've just always been told that they're allergic. Any guidance on that as far as how you would handle it in that situation as an ID pharmacist?
It would be good to know how long it has been, because if it's been longer than 10 years, it may have been just the way that the drug was manufactured at that time, because there's been lots of updates in how things have been manufactured. It may have been not necessarily the drug itself, but maybe even some of the excipients or fillers that were used at that time. Like I said, even the dyes. So it's important to know what the circumstances were, how long it's been, if you've tried anything in recent years. So as an example, if they have a penicillin allergy and they've used like a first generation cephalosporin such as Keflex, if it's required, you could use like a third generation such as ceftriaxone, and it would be appropriate to put in the allergies tolerates ceftriaxone or tolerates Keflex, because then that alleviates more questions when it becomes more of an acute setting.
So if I'm somebody in a setting where I want to try to join your team and be part of this collaboration to try to help with the antimicrobial stewardship in the state, is there any education resources that you might recommend?
Sure. There's several that I would recommend. Some of them would, the CDC is they have a program called Keep Antibiotics Working, and that's for prescribers and patients. There's also a website called ID Stewardship, and they provide resources about learning about infectious diseases and different antibiotics and things to look out for, like side effects, efficacy, like their bug drug coverages or spectra. Pay attention to local antibiograms. So if you have access to outpatient antibiograms at your hospital, that would be another way that you could do it. There's a webpage, Contagion. They cover news resources, all areas of infectious diseases all over the world. They even tell you where there's outbreaks at the time. But it also covers common antibiotic issues or local antibiotic issues. There's the SIDP also provides CE, or Society of Infectious Disease Pharmacists. They provide CE on their website. Some of it's even free. Currently, they have one on breakpoints for your MICs of your antibiotics. They have podcasts just like this also. And upcoming, the West Virginia Antibiotic Awareness will have educational resources there. And
the West Virginia Office of Epidemiology and Prevention Services also has some great quick links and checklists and PDFs to help you as well. As we are wrapping things up on this, we have a number of students and young pharmacists out there who digest their information through podcasts such as this. So for all those out there who are still trying to find their career path in pharmacy, what's the most rewarding part of your job?
My favorite part of it is when we actually see the patient getting better based on the dosing, the drugs we've selected. Unlike chronic conditions, most infections can be cured. So it's great to see when the information we've provided helps guide their care and see them actually getting better, watching the white blood cell count improve, they're no longer fevered, their mental status is improved, and then watching them heal and be able to walk away like it never happened. That's the best part of working as an ID pharmacist, because even just in the hospital, you can see them in the outpatient setting. Depending on where you're at, you can see them improving and eventually healing.
Yeah, that's a great point. You're in a very powerful position to be able to bring care to patients and bring them back to their status prior to when they came in. So that's a really cool superpower to have. So I would love to thank you for coming on the podcast. We're going to post up all the resources that she mentioned in the show notes, so you can see all those things and use it as a reference if you want. But I thank you, Jen, for coming on the podcast and sharing with us about antibiotic resistance and antimicrobial stewardship. And happy Infectious Disease Pharmacy Day to you and all of your colleagues who are helping us around the state of West Virginia.
Well, thank you, Matt. Much appreciated. And thank you for the opportunity.
Mountain State Pharmacists is a product of the West Virginia Pharmacists Association.